All right, we're going to get things started. I do still see people hopping on, but we will get rolling because we have a lot of information today. So I just want to confirm with my panel, with Brenna, that you can see and hear me.
Yes, to both.
Awesome. Great. Thank you. Thanks for helping me out today.
Of course.
I want to give a shout out to Brenna Larson. She is the other training specialist on our Child Care Center licensing unit team. My name is Lisa Mills, and I welcome you all to today's session. All right. Again, good afternoon to all of you, and welcome to today's Summer 2024 Outreach Connection webinar from the Child Care Center licensing unit. Again, I am Lisa Mills. I am a training specialist and today's host from the Child Care Center licensing unit within the licensing division of the Minnesota Department of Human Services. First, I would like to thank you for being here. And from all of us here, because there's many of us here to share with you today, we would all like to thank you for all of the work that you do. We know what you do is so important. And it's very hard. And so thank you for taking your time out today to join us and to hear what we have to offer and talk to you about. Our Outreach Connection webinars are one way we as a licensing team have worked to bring relevant information together from us and some of our state partners to make certain you are hearing information and updates directly from us, in addition to other ways that we communicate information, such as via our email and our website. We work very hard to connect, to hear from you, to work for ways to support the work that you do for the children and families of Minnesota. Today's presentation is just that, a way to connect and provide what we think is valuable and useful information for you. Before we get started, we have a couple housekeeping items to go over. First, an accessible handout with links to more information from today's Outreach Connection webinar has been posted to the DHS Child Care Center licensing website under the News and Updates section. Also, I would like to note that today's webinar is being recorded. Once the recording is transcribed and captioned, we hope to post the recording to our Child Care Center licensing webpage. But I advise you to hold tight for a bit because it does take some time for it to be transformed into a format that we can post. So give it a few days, maybe a week, and that's our goal. We're hoping to get it up there as soon as possible. And last, we are here to answer your questions. We know it's hard for you to be able to interact with us at times, but we are working our best to be able to provide you with that forum. We have a chat available and we have a panel of experts here with us today to answer questions as they come in. They are waiting for your questions to come in. So please use the chat to do that. When you use the chat, please make certain that you are addressing your questions to the panel, because if you address them directly privately to me, it's very likely I won't see them until after the recording is finished and the webinar is done. So again, our panel is here for your questions. Our panel will summarize your question as best they can and also answer it as best they can in the chat again, so that everyone will be able to see the answers to your questions. And now our agenda for this afternoon. We have heard from license holders that there are certain topics that they want to hear more about. And there is so much going on in our industry right now. So we take that feedback and we connect with many of the other content specialists throughout our Department of Human Services, and many of those areas that are transitioning to the new Department of Children, Youth, and Families, as well as our partners from other state agencies such as the Department of Health. We have a lot of those content experts with us today to provide information. And first you will hear from Peggy Cunningham and Karen Kunze, who will share licensing and legislative updates that came out of the recent 2024 legislative session. Brandon Tice is here to share information about the ongoing childcare regulation modernization project. We have Elizabeth Adland. She is here to provide updates on the systems transformation project. Then we have Brianne Peterson here to provide information from our partners at the Child Care Assistance Program. Dana Ellingson has information on the Great Start Compensation Support Payment Program. Mi Vang is here to provide updates from Parent Aware. And then we have from the Minnesota Department of Health, Caroline Olstad and Anna Schleep. They are here to provide information about lead testing requirements. So as you can see or hear, we have a lot of information to cover, and therefore I would like to introduce our Child Care Center Licensing Unit Manager, Peggy Cunningham, who will kick things off. So there you go, Peggy. Take it away.
Thank you, Lisa.
All right.
Hello, everybody. As Lisa said, my name is Peggy Cunningham, and at DHS, I manage our team that licenses childcare centers and also certifies our license exempt childcare centers. I also want to thank you for taking time out of your incredibly busy days to listen to this information that we will be sharing. As always, our goal is to provide you with information that will be helpful to you in leaving this and continuing to operate your centers. So related to licensing specifically, we wanted to utilize the time to bring you updated information on topics that we believe are of high interest to you as a licensed childcare center at this point in time. And so we're going to focus on new legislation that came out of this year's session and on updates on the licensing regulation modernization project. In particular to the project, the revised licensing standards draft that was recently released. So this project is led by our policy, legislation, and stakeholder team, while myself and others from our Child Care Center licensing unit are working very closely with them on it. And input and feedback from you as providers, as well as many other stakeholders, is absolutely essential to the success of this project. And in a few minutes, you will hear a little bit more about opportunities for you to be involved in the project and to provide feedback to a variety of pieces. So Karen Kunze and Brandon Tice are here, as Lisa said, and Karen will share updates on the new legislation, Brandon on the modernization project. But before I hand it off to them, I also want to thank you for the critical work you do to educate and care for kids all around the state. We appreciate you, and by working together, we can continue to make sure that children are safe and healthy in the environments that you all provide for them. Also, licensors are very much a resource for you. And when you have a question, please don't hesitate to reach out to your licensor. And if they aren't available, we of course always have a licensor on call 8 to 4:30 Monday through Friday. And they can also provide you with guidance and assistance in whatever your needs may be. So thank you again. And with that, I will hand it off to Karen.
Great, thanks, Peggy. Go to the next slide. Like Peggy said, I'll be going through a couple of highlights of things that passed during the recent 2024 legislative session. As always, we'll be doing an implementation plan, so you can expect to receive that this summer. That will go through in more details these items, but this is just a preview of what to expect. So you can see the various topics I'll be covering in the next couple of slides. Go to the next slide. So the first item that I wanted to highlight relates to the risk reduction plan. So you guys probably remember a few years ago, back in 2020, the definition of supervision was expanded to allow for a preschooler to use an individual private restroom within the classroom with the door closed. At the time, corresponding language should have been added to the risk reduction plan in 245A.66 subdivision 2. This is consistent with how other changes to the definition of supervision have been handled, but it was just kind of accidentally missed in 2020. So this year, language was added there. So if this is something that your center utilizes this supervision flexibility, then you're going to need to add it into the risk reduction plan and make sure your staff are updated on that change. So this is effective August 1st of this year. Next, I want to talk about the weighted risk system. So language was added into statute this year to adopt the weighted risk system. So the weighted risk system is a tiered licensing enforcement framework where a weight is assigned to each regulation. And that represents the potential impact to children if the regulation is violated. This new system will replace the need for the current fix-it ticket system. The language that's currently in 245A.065 about fix-it tickets will expire upon implementation of the weighted risk system. And it's expected to replace it because we anticipate that there will be a greater number of regulations eligible for documented technical assistance. I'm sure you have a lot of questions about what this means, and I just want to assure you there's no changes imminent, nothing you need to change right now or be aware of. The timing of this implementation, it will be sometime after the provider hub is live for all child care license types. So this is just a heads up at this point, and we will definitely be providing more information when we're getting closer and ready to implement this new system. Next slide. There's a change to the reusable water bottle and cups language in 245A.14 subdivision 17. Beginning July 1st, if you would like to send the water bottle or cup home with the child's parent or legal guardian to have them clean and sanitize it each day it is used, you may now do that. If that is something you want to do, then just update your written policy to reflect this change. Next, I want to talk about contraindicated physical restraints. So last year, language was put into statute related to prone restraints and contraindicated physical restraints. You can see the first bullet there shows the language that was added related to contraindicated restraints. And there were several questions about what it meant to assess and if a formal assessment was needed. So the new language you can see is in the second bullet there, and it just clarifies that an assessment isn't needed. You only need to document if there's a known medical or psychological condition. So if that's the case where you are aware of a known condition, just include that in the individual's child care program plan. And this is already effective. Next slide. As you guys know, the new Department of Children, Youth, and Families is being stood up very soon. So in anticipation of that new department, the legislature passed some conforming changes to many parts of statute, including child care licensing. These were all technical changes, not substantive. So for example, they're moving all of the existing language to a new licensing chapter for programs that will be licensed by DCYF. Additionally, they changed references from Department of Human Services to the Department of Children, Youth, and Families. For licensing, we aren't anticipated to move to the new department until next year. Probably, I believe the anticipated date is July 2025. So these changes won't go into effect until we move. So at that time, we will be sure to provide more details for you about where to find different parts of statutes. So nothing you need to do right now, just wanted to give you a heads up about this. And with that, I will turn it over to Brandon.
Thanks, Karen, and good afternoon, everyone. All right, are we ready to talk about draft revised licensing standards? We are going to get into the details of the what, the why, and the how of draft licensing standards, some of the public engagement opportunities, including this one today that we have. And yeah, that's the plan. So next slide, please. Okay, so as Karen mentioned, the weighted risk system language was passed in this last legislative session, allowing adoption of the weighted risk system. And we are waiting to do that until after the provider hub is implemented for all childcare license types. So just a heads up on that. And we just acknowledging that we know there's a lot of change right now. And same with the abbreviated inspections. Both of those pieces, those are the more data-driven components of our regulation modernization project. So because of all the back-end work being done with the provider hub, really we're dependent on those data pieces being cemented and finalized before implementation can occur. But beyond that, you're also dealing with a lot of change with the provider hub being implemented. So we're also just being mindful of that. Um, so next slide. So why are we revising childcare licensing standards? This is just some background about where this is coming from. In 2021, the Minnesota legislature directed DHS to work with the National Association for Regulatory Administration, or NARA, to develop revised licensing standards. They specified that they should be grounded, they must be grounded in national regulatory best practices, and they must protect the health and safety of children and be child-centered, family-friendly, and fair to providers. So that's where that authorization for this project and this revised standards work is coming from. We've learned a lot about child development and safety since Minnesota's child care licensing standards were first adopted in the 1980s. And we acknowledge that, statute and pieces of 245A have been updated since then. There have been changes, and we know that child care programs are continually adapting and changing their practices. But in terms of the actual rule of 9503, that hasn't been updated since the 1980s. So that's really what this project is about, updating both that rule of 9503 and pieces of the statute 245A that apply to child care centers. And also to also to licensed family childcare. Today we're just talking about childcare centers. So the draft revised licensing standards were released to the public on April 22nd. They're simply a draft. Your feedback is going to help inform a revised draft. We released it specifically to get your input, and we really do want your input. This really will inform the changes that will be made in this draft. It's also not a legislative proposal. So after we get the feedback, we will plan to bring that forward to the 2025 legislative session. And that is when the legislature will consider the proposal, consider that revised draft as a legislative proposal. And also, as a measure of transparency, we intend to share the final draft before we bring it to the legislature. So in late fall, we anticipate we'll have that feedback incorporated. We'll be ready to release it publicly so that you all can see, what was incorporated, and you have a chance to look at it before it goes to the legislature. There's not going to be, a broad set of public engagement sessions like we're doing now, but you will have your chance to weigh in, as it goes through the legislature. Next slide. In terms of what types of changes were made in the licensing standards. So we think about it in terms of 3 buckets. One is updating health and safety language based on NARA questions. So this change was made. Environmental health is an example of this. So some of those new provisions you'll see in terms of radon testing, in terms of testing for lead in the soil, because one of the things we've learned in this process, working with MDH and also with NARA, is any amount of exposure to lead is not a safe level, and so that can be a contaminant in the soil. So some of those environmental health provisions are new requirements, and that is based on NARA and other subject matter expert recommendations. Cleaning and sanitizing, disinfecting is another example of that type of change. Other types of changes are, sorry, can you go back? The second bullet there, refining language where we have lived into it over the years. So behavior guidance is an example of this, where things simply get, from when the rule language was first put into rule, and then the way that behavior guidance is, the way there's training now and resources and the way it's done and documented. So just updating some definitions in the behavior guidance section and trying to make it clearer how to document certain behavior concerns and respond in that way. And then the third bullet is revising areas where we've heard feedback that the current rule language is just creating challenges. So the staff qualifications and adding some more flexibility to being able to rotate equipment or toys, materials in and out of the classrooms, being examples of that. Next slide. How are the draft licensing standards created? This is just a little more background. NARA did an initial background and literature review, including looking at Caring for Our Children, which is a national resource of licensing best practices. They also looked at other states, such as Colorado, Washington, and Missouri, which were states that were either comparable to Minnesota or had recently done a rule revision to get some inspiration from what those other states were doing in their regulations. Then DHS, we also put together this initial survey, which hopefully some of you were able to respond to. It was an initial survey to gather feedback on what was working or not working about existing regulations. Based on that, there was a draft created, and then we did some targeted engagement work on that draft in areas that really just needed more fine tuning before releasing it publicly. So we worked with state agencies to do that. That's the Minnesota Department of Health. We worked with we had some targeted childcare provider listening sessions, including on the equipment and supplies. We had a staff qualifications work group that many we had about 20 different members participate in that, and also some early childhood organizations like Center for Inclusive Childcare. So some of that feedback informed this draft that was released on April 22nd, just as some background. Next slide. Okay, in terms of how we're collecting input on the draft licensing standards. So we're definitely taking and open to any questions you have today. We also are planning, we have an online survey, which I think we can get the link in the chat for that. Unfortunately, I don't think we were able to add it to the handout for today in time because it just went live yesterday, but this is an online survey that anyone can respond to. It asks about the clarity, the effort, and the value of the different sections of the revised standards. So if you wanted to go and say, I want to look at the teacher qualifications and provide input on subdivision 2, where it talks about the education and experience requirements, and I want to share my feedback on that. You can do, there's open-ended questions, and there's also some more targeted sort of multiple choice questions that you can provide input on whichever section you would like to, and you can do as little or as much as you want. So we're excited that that survey is live and open to anyone. We also are conducting one-on-one interviews with randomly selected providers across the state, and Wilder Research is going to be conducting those interviews on our behalf. And then we're hosting regional listening sessions for providers and the public, and that's happening in it's happening now. We had our first one last week in Grand Rapids. We've got 2 coming up next week. One is in St. Cloud, and the other will be here in the Twin Cities at the Southdale Public Library. So please, I think we also have, Karen just posted the listening sessions link in the chat. So that is, again, welcome to providers, to licensors, to the public, welcome to anyone to attend. And then we're also talking to licensors, hosting some focus groups to get their input as well. And as always, you can email us using the shared inbox, and we check it every day. So please do contact us. Next slide. And then how will I know we want to use your feedback. We really do. We've gotten already just some of the emails in the shared inbox on the center's side. That the part of the project I work on, I know that we really they've been helpful in helping us clarify this language and if it's working and captures our intent. So please do reach out. Please give feedback. All of the feedback we get during this time period until at least July 15th is when the survey is going to be open that we know. During that period, all this that we collect, we are going to then compile it all and then analyze it and identify key themes and areas that need updating. So once we identify those areas, we'll be able to incorporate those changes. And again, late in the fall, you'll be able to see the revised version that incorporates the feedback we got. So, look forward to that as well. Next slide. Okay, and this is just some notes on staff qualifications. We just want to specifically call this out because we have gotten many questions on this part of the revised standards. First, just want to encourage people to focus when they're reading this section. Focus on the new definitions of education in 245K04, which is the qualification, kind of the first qualification section. And read that before going into the teacher and assistant teacher qualifications. This is because there are two new definitions of education, or it's sort of a two-part definition. One is general education, and the other is post-secondary child development education. And we know that child development education terminology is maybe has led people to think, oh, it's only very specifically early childhood or child development focused topics that are included in this. But if you compare the definition of that with the Rule 9503 language that it currently exists and is currently in place, you'll see that there is, it's almost all of the same coursework included in this new post-secondary child development education definition. So when you take that child development education and the new general education definition, it actually is an expanded list of courses that are acceptable. And that is our intent with this revised language based on the work group that we put together to add more flexibility in terms of what coursework is counting towards that education. So if you read that section and if you really dig into that and you still have questions, please feel free to reach out and email us. And we will definitely respond to you, and that's very helpful. Okay. And again, this slide is pointing out some of the highlights of what we wanted to do differently with the draft of 245K is if you compare qualifications for those with a high school diploma, you'll see there's actually a reduced educational credit requirement, 12 semester credits versus 16. There's more flexibility in coursework. You can have things like math, science, and English counting towards it. And there is also a requirement to take childcare basics training. And this is a training, it's spelled out more in the training section of the draft, but the concept is that it's a foundational training. It would be developed by DHS and available so that staff that are just starting in childcare centers all have a sort of shared understanding of what, how does licensing work, working with children with special healthcare needs, things that we think would be foundational to working in the childcare setting. And the intent is that training would count towards in-service training requirements. Okay, that was a lot we just threw at you. So next slide, please. And then we could kind of skip through these slides. This just goes into more detail about comparing the definitions of education, but I know we have limited time, so I just encourage you to look at that on your own time. And we're working to post a staff qualifications fact sheet to our website, which goes into all of this more in depth. So more to come on that. Okay, next slide. And next slide. And yeah, just next slide. Okay, and then finally, next steps, again, just reiterating, until at least July 15th, we'll be taking this public input. Then we'll review feedback and incorporate changes. And then later in the fall, we anticipate publicly sharing that revised draft and bringing it forward to the legislature where, as we know, there can also continue to be discussion and further changes. Okay. And now Elizabeth can take it away.
Sounds good. Thanks, Brandon.
Oh, sorry. Oh yeah, I'll just let you get started. I just asked Stu's question, but I'll just
go ahead and answer the questions.
Okay. Let's see. Will the childcare basics training then take the place of some of the orientation? Some of the orientation type will be offered for free and develop approved. I think some of the I might have to phone a friend and get clarification from Peggy on the develop approved piece. I know that the intent is that it would be free, and I believe yes, some of the topics would replace some of the orientation topics as well.
Yes, and I'll just add in that the goal is to make it easily and readily available to all of you. So as you hire new staff, it will be there for your new staff person to access. So that is the goal.
Yeah, thanks, Peggy. And I also see Megan's question. So then does this mean that the current list of post-secondary credits being accepted will go away entirely? Then half of the credits will be required to be okay, it's specifically in education, child psychology, and child development. Um, so thank you for the question, Megan. So that is not the if you and I I'm sorry because we don't have the fact sheet and we want to put it out there, but if you do look at the definitions, the existing Rule 9503 definition, uh, all of the coursework that is covered in that existing definition is in the child development education definition in the new draft. The one exception is I think it's like arts and crafts, methods, and theory, which we did move into just the general education definition. But so the intent would be that if you have a staff person that is qualifying now with that Rule 9503 definition, because all of those coursework topics are in the child development education definition, they would easily meet that 50% requirement. Now, I know we've gotten some questions on this, and how would it we know that there's the expanded kind of course list that's on the Child Care Center licensing website, and so I think there's still we want to work it out and pay attention to the feedback we're getting, and the feedback you're getting is exactly if you have further questions or comments, we want to hear that. But again, that is the intent, is that if you would qualify in their existing definition, you would still qualify in the child development courses. Okay. All right. Take it away, Elizabeth.
Sounds good. Thanks, Brandon. Hi, everyone. My name is Elizabeth Adland. I am the manager of our digital service unit here in the Office of Inspector General, and I also serve as the product group manager for the digital products that we're building and maintaining for you all. And want to just take a moment at the start to just thank you all for the work that you do. I'm a parent myself and have 2 young boys that are in childcare, and so I always say that I could not be here doing the work that I'm doing if it weren't for the work that you're doing. So thank you. And prior to serving in my current role, I was a center director and actually worked at all the positions in the center. Served some time in our licensing unit with our licensing partners here, and now have the pleasure of working on building some innovative licensing solutions to move us forward and streamline things through technology. So the childcare industry is near and dear to my heart, and I always value the work that you do. So kicking off for the next slide here, I want to just ground us. This is our vision, and I hope you've seen this before, because we really speak to it every single time that we present or talk to folks, because this is the North Star that that our whole team drives towards. We want to create a seamless, tailored, and intuitive experience that inspires confidence and boosts satisfaction through enhanced transparency, efficiency, and consistency. So everything that our team is doing when we are adding features to the provider hub, or working on something, or creating new possibilities that we could add in for you, this is what we are comparing it to make sure we're heading in the right direction and driving towards that. And hopefully you see that in the work that we do as well. This slide is really showing sort of the layered approach that the Provider Hub has. So at the very basic level, the Provider Hub is helping you manage your childcare license and apply for additional licenses should you need that. So license management and information management at a very basic level. This has built and grown, as you may realize, as we've gone through this work, because that end goal and that vision that I just spoke to is really to give you one centralized place so that you're not navigating through a number of different websites or talking to a number of different people in different areas. We want to simplify that process for you so that you as childcare providers can spend more time where it means the most, which is with children and families, and less time trying to navigate these processes related to your license. So very basic level, applying for and managing your license. We're then layering on funding opportunities, like connecting you to resources to help you grow and sustain your childcare business. So the Great Start compensation application is being added in, and you'll hear more about that in a little bit, along with the Child Care Assistance Program application that you'll also hear about. So layering those into the Provider Hub experience, so you're able to access and manage those in the same place that you're managing your license. And then the next layer is adding on features you might need as needed, like reporting incidents, paying fees, and complying with funding requirements. So really building towards that holistic approach of having everything in one place for you. And that is continuing to shift and change. And so we always are open to feedback, and whenever we hear ideas or other opportunities to streamline things, we are happy to figure out how we can possibly build towards that in the future, because we're here to simplify things for you. Here is an image of our timeline and the journey that we've been on so far, and a little bit of where we're headed. So we went live with our very first launch of this in April 2023 with certified childcare. Wayfinder went live right around the same time. So if you connect with a Wayfinder navigator to get resources or build your capacity as a provider, they're kind of operating in our same ecosystem, really helping to build those connections there too. So there's a strengthened connection between licensing and Wayfinder, because really we want to work hand in hand again, so that we're connecting behind the scenes so that you don't need to connect through all these different places. We went live with licensed childcare centers and our product experience support in November of 2023, an early learning scholarships pilot in January 2024. And now here we are gearing up for launching some of our supporting features and funding opportunities, like the Great Start Compensation Program application and enrollment and attendance to go along with that. Coming up in the future, early learning scholarships rolling out. That's a Pathway 1 scholarship with families and those scholarship administrators launching statewide. Phase 3, which is our family child care pilot and then full launch, along with our licensing information lookup redesign, is targeted for fall 2022. Looking ahead to 2025, this will be expanding beyond childcare to fold in foster care, home and community-based services types programs, mental health and substance use, legal appeals. Really, this will especially be beneficial for organizations or persons who hold multiple license types. For example, if you are the owner of a childcare business, but you are also a foster parent, you'll be able to manage both of those within the same login and in that same space. CCAP provider registration will also be coming at that time. And then just want to emphasize the last item there, which is continuous improvement and maintenance. So we will continue to add and change things as needed based on feedback that we hear from all of you to just continue to optimize and make things even better. This is just another, I'm not going to go too deep into this slide. This is just another view and maybe an easier way of looking at what's going on in our world right now. So in our systems world. So what's available today is on the left. Pieces that are in development are in the middle, and things that we have slated for the future but development has not started yet are on the far right there. So a lot of different moving parts and pieces, and a lot of people and different areas that are really collaborating together because we all have the shared goal of supporting you as providers. Want to give an update on personnel redesign. So you may have heard we've sent out surveys and previously shared that the number one feedback we've heard from both providers and licensors, because licensors also use the hub, theirs is called the agency hub, and they're two sides of the same coin, was that the personnel features and functionality, the experience in general, was not meeting the needs. So after hearing this feedback, we created a dedicated team focused on evaluating and redesigning the personnel functionality for both providers and licensors. So we're doing deep exploration into what the current experience is, what the sentiments are about it, what people like and don't like, and then what the desired user experience is. So we've done some surveys, workshops, and we're doing we receive feedback in all sorts of ways. You're always welcome to send us feedback. There's an email address I'll share at the end. We hang on to every piece of feedback we receive. And so part of this has been doing a comprehensive review of feedback that we've received to date. And then we recently started building the redesigned experience. And updates on this will be sent out on a regular basis, including like previews of it, some demos, mock-ups, interactive prototypes. Really excited to share that with you as we continue to build, and we anticipate that we'll launch this redesigned experience in fall 2024. And one piece that I want to speak to here that we've gotten questions about is what about develop? And I just want to emphasize that develop is still very much our connection with develop is built. It's actually ready to go. We are intentionally not launching that develop integration until we've redesigned this personnel experience. Just based on the information that we've heard from all of you as providers, if we were to turn on that develop integration right now, it would create more strain into this experience that people, are saying they're not really happy with. And so we want to wait to make sure that the develop experience can go along with this new redesigned experience and be a much smoother process. And then here's just a snapshot. The key takeaway really from the survey that we sent out to providers about the personnel experience related to the redesign. So this particular question was just evaluating this current satisfaction with the personnel feature. There's a range of opinions. Generally what we've seen is smaller providers that are maybe have just a handful of staff. They're more or less okay with it. They're giving it like a 4 out of 5 or a 5 out of 5 because they have fewer staff to input and manage. Larger centers, which I know on average are many programs have more than a handful, are seeing less satisfaction with that. So the majority of people are falling between a 1 and 3 out of 5. And so the key takeaway is just that the overall provider satisfaction with the personnel feature is low. Really, this is just validating, what we had really heard through anecdotal feedback. But our team is all about data and making sure that that we're getting a good baseline from the provider group. The other takeaway from that survey was just information of what we heard were the top provider priorities for improvements, like adding and updating training, particularly adding a single training to multiple personnel or adding multiple trainings to multiple personnel. What's really common for you as providers would be to maybe host a training day where you're going to have 5 trainings on your list, and you're going to give those 5 trainings to all of your staff. And so what we've heard is really important for you is to be able to say, here's these 5 trainings that I did, and then adding those to whoever attended instead of having to go through one by one to individually do it over and over again. That's been a big one we heard. Also, different ways of viewing your staff rosters and upcoming training expirations and searching for staff members. So kind of like filtering and sorting capabilities. Lower priorities that we heard of was adding staff to multiple programs and substitute management. I want to emphasize that just because it's a lower priority, that doesn't mean it's not a priority. Really, all that means is that we're going to focus immediately on those top provider priorities. And those lower priorities, we're still hanging on to those and saving them. Those will come at a future date, but they didn't come through as being what would bring the most value to you all as providers. a sneak peek into licensing information lookup redesign. This is actually a screenshot from our build. So this is roughly what it will look like for the look and feel. It will give providers and families and the general public the ability to search for providers based on proximity to an address, like their home or their place of business, as well as viewing a map of providers and where they're located. There'll also be more information visible in search results. So as you can kind of see on the screen, there's just more information that you see before you click into a program. So you'll be able to kind of see at a glance the parent aware rating, or potentially like whether they're registered for CCAP and in what counties, their hours, some other basic things to just give more of an at a glance view. And that's in addition to some of the other features that we've talked about in the past, like the ability to add a bio and a photo or a logo from providers. Those things will be available once you click into a program. So we're really excited to be continuing development from that. Here is an overview of what is coming with phase 3 in fall 2024. We'll be bringing family childcare licensing and counties on board at that time. We added a pilot phase and are currently determining the criteria for that pilot. That was one of our big lessons learned from when we rolled out to licensed childcare centers, was that a pilot phase would have been really beneficial. So we're taking that lesson learned forward to our next iteration of this. The public website will be coming out with this phase 3. And then CCAP, that functionality is being moved to April of 2025 to align with the centralization of registration. And then let's stay in touch. We want to message and communicate with you and get you our information, make sure you're in the loop, however it works best for you. So here's a couple different options of things we have available. We send out GovDelivery emails on a semi-regular basis, so check your email for announcements and information. We've got a website that was recently completely overhauled, so if you haven't been to it in a while, I would recommend you check it out again. And we've got a few more experts that we've hired and that are on board recently that'll be able to keep that website a little bit more up to date with some of our upcoming events and informational sessions that we have. We also have a Change Network. For those of you on this call that are in our Change Network, thank you. Always great to see you each month. If you're not in the Change Network and you would like to participate, send us an email to that product team email on the slide here. It's ccproviderhub.dhs@state.mn.us. And I can put that in the chat as well. The Change Network is like a focus group of providers that we meet with each month for about an hour to go over things we're considering, changes that we've heard, feedback that we've heard, and really gives us sort of like a small representative sample of providers to do some in-depth discussion and work with. So would encourage anyone who's interested to reach out about that. I see that there's been some questions that are coming in the chat. For the sake of time, I'm going to respond to those in the chat. And so I will hand off to the next person, who is Brianne Peterson. Take it away, Brianne.
Hello, everyone. Thank you, Elizabeth, and thank you, everyone, for being here today. I'm Brianne Peterson, a provider supports lead with the Child Care Assistance Program, and I'm going to give some updates that apply to the Child Care Assistance Program, as well as some changes we may be seeing in the future. I can go ahead and thank you. So if you're not familiar, the Child Care Assistance Program helps families with low income pay for childcare while they work or go to school. If you want more information about the Child Care Assistance Program, including how to register, the rates we pay providers, and other resources, that's all in that handout that was shared in the chat earlier, and that will be posted on the website. So first, I want to talk about some changes that occurred as a result of the 2023 legislative session. You may have heard about some of these changes, but I'm going to just quickly go through them today. So one of the most impactful changes to childcare providers was the rates the Child Care Assistance Program pays providers increased to the 75th percentile of the most recent market rate survey. So this past October, rates were adjusted, or not, sorry, October of it was this past October. October 2023, rates were adjusted to meet that standard. Market rate surveys are conducted every 3 years. So we actually just finished up our 2024 market rate survey, and we're analyzing that data right now. And in January, the CCAP payment rates will again be adjusted to be the 75th percentile of the 2024 market rate survey. So you may see some rate increases, not all rates increase, but no rates decrease. So nobody will see that. Beginning this August 2024, CCAP eligibility is going to expand to include foster care parents and relative custodians. Right now, those types of caregivers aren't eligible to apply for child care assistance on behalf of the children they're caring for. Starting this August, they'll be able to. They do still have to meet our income and activity guidelines. So it's not as expansive as it could be, but we still expect to see an increase in 1,300 families or 2,600 children. This past January, there's an increase in CCAP funding that resulted in increased childcare access for an estimated 500 additional families, including 1,000 children. And by July 2026, we at the department, we're transitioning to the Department of Children, Youth, and Families next month, along with early learning scholarships. We're working together to give a report back to the legislature on how we'd implement something called the Great Start Scholarship Program. The Great Start Scholarship Program would integrate administrative and funding structures from both the Child Care Assistance Program and early learning scholarships, with the long-term goal of capping family contributions to childcare cost at 7% of a family's income. So more information to come. We have a lot of work to do with this report and certainly a lot of engagement. Go to the next slide. Thank you. Next April 2025, there's going to be several changes that affect child care assistance program providers. So starting next April, providers will be submitting their registrations, renewals, and changes to their child care assistance program information to the Department of Children, Youth, and Families instead of CCAP agencies. So the staff here at the Child Care Assistance Program, again, we're moving to the Department of Children, Youth, and Families next month. So we'll have additional staff working at the Department of Children, Youth, and Families that will be processing the CCAP registration, renewal, and change information. Right now, providers have to register with the CCAP agencies that serve a family's case. And this results in many providers being registered with multiple agencies. About 1/3 of our providers experience that right now. And we know that's just redundant, inefficient on many different levels. So that's why we're making this change. Also, starting next April, providers will be able to use the Provider Hub to register, renew, and make changes to their child care assistance information. And finally, with all the centralization of CCAP changes, registration, renewal information to the Department of Children, Youth, and Families, we're also able to standardize some provider policies. For example, right now, CCAP agencies determine if providers can use our electronic billing system known as NEC² Pro. Starting next spring, that's one of the policies the Department of Children, Youth, and Families will be centralizing. So we're going to allow all providers the choice in how they bill the child care assistance program. Providers will be able to choose if they want to bill using the paper bills or our electronic billing system, NEC² Pro. Looking ahead into even further in the future, the federal government recently announced several changes to the Child Care and Development Fund. Minnesota must comply with the Child Care and Development Fund rules in order to access federal funding to the Child Care Assistance Program. And some of these rules changes have a great impact to providers. And one set of rule changes has to do with payment policies. So the new federal rule is going to require that states pay providers prospectively rather than after child care occurs. So right now, child care assistance pays providers after child care is occurring, and we have 21 days to pay that bill. That will have to change in order to comply with the federal rule. The new federal rule also will require that we pay some providers using grants or contracts for some children. And it also requires that we pay based on a child's enrollment. So in Minnesota, this is going to mean that we need to expand our payments beyond how we pay now, which is based on scheduled and authorized hours. So this could include expanding how we pay providers for absent days and days they're closed for things like vacations and inclement weather. The new rule also encourages states to set their state subsidy reimbursement rate on the actual cost of operating a child care center rather than the market rate survey. And in many cases, the actual cost of operating the child care center is higher than the market rate survey results that we get. So Minnesota is expected to be in compliance with these rules by August 2026. So we're planning to bring these statute changes to the legislature in 2025. And then as we go through that process, we'll have more information on when some of these changes might actually occur and what that looks like. The new federal rule also lowers family costs for childcare by requiring states to cap family copayments at 7% of a family's income for families who are using childcare assistance. And the new federal rule also encourages states to waive copays for some families. So end result, the new federal rule is making changes that are going to result in copays decreasing for all, if not most, families using childcare assistance. And right now, the copays for the child care assistance program, those go up to 14% of a family's income. So in some cases, it will be a dramatic impact to some families. So again, Minnesota is expected to be in compliance with this by August 2026. We again will take this to the 2025 legislature. We do need our statute to change in order to implement this rule. So we'll bring that forth next year and we'll see what happens. Thank you so much. I'll pass it to Dana. Or me, sorry.
Thank you, Brianne. I hope you guys can hear me. Good afternoon. I appreciate you all for joining us. And me, Vang, here again. I am a supervisor overseeing Parent Aware and Develop, which is Minnesota's registry tool. I want to provide some updates regarding Parent Aware, but want to start with some backgrounds on what Parent Aware is. Parent Aware is Minnesota's QIS, or Quality Rating and Improvement System, and was piloted in the early 2000s. It continues to offer tools and resources to help families and quality childcare, or find quality childcare and early education. Since the inception of Parent Aware and with the support of many partners, we have worked hard to ensure the quality standards and indicators for the Parent Aware rating tool, reflecting best practices that are most predictive of school readiness. We expanded the pathways available to programs to meet Parent Aware standards and indicators, full rating, accelerated, automatic, and expedited pathways. The full rating pathway is for unaccredited licensed childcare centers and family childcare programs. Nearly half of all our rated programs are rated via the full rating pathways, while the other three pathways are available because accredited childcare, public school, pre-kindergarten, Head Start programs that meet some or all of Parent Aware indicators through the national accreditation requirements or state law or federal regulations. And each of these pathways has an entity that is accountable for ensuring the quality requirements are met. So next slide, please. As we move to what's new with Parent Aware, I wanted to share with all of you that the Minnesota Department of Human Services, moving to the Department of Children, Youth, and Families, engaged in an effort to better understand and address inequities within Parent Aware in 2021. And as a part of this effort, the department collaborated with our Parent Aware partners through the Parent Aware Racial Equity Action Plan work group. And we engaged with hundreds of childcare programs across the state to identify and report on barriers to create a plan for improvement. I really want to just take this time and pause and thank all of you that have already been a part of these engagement opportunities. The department is now moving into the next phase of this work, gathering additional data and community input, completing a legislatively required evaluation, and implementing recommendations through the Parent Aware redesign. This multi-year effort includes multiple projects and centers, best practices, on racial, cultural, linguistic abilities, and geographic equity. The Parent Aware One Star initiative highlights the Minnesota legislation that passed in 2023 to ensure equity for all programs and providers to be able to be rated for receiving more resources. Starting on July 1st of 2026, all licensed childcare providers that are in good standing with the state or their tribe will automatically receive a one-star Parent Aware rating, unless they are already rated or choose to opt out. So the state's goal is to make sure families have access to quality, affordable childcare, and that children receive the best care possible. In March of this year, childcare programs in good standing with the state or their tribe have already started to begin signing an agreement committing to accept the automatic one-star when it is available in 2026. By signing this commitment agreement, programs will be eligible to serve children receiving early learning scholarships and will be featured on the Parent Aware website. The department will bring forward recommendations for implementing changes to Parent Aware in a report to the 2025 legislature. And so now I'm going to see if there are any questions that I can answer. And it looks like there are some questions regarding free school meals. And so I may pass that to another one of my colleagues that may have that answer. But I will hand the floor now to Dana.
I'm just going to point out that this is Peggy speaking, that I just put an answer to that question in the chat.
Thank you, Peggy.
Sure.
All right, I'm hoping you can hear me. And I will move forward here.
We can hear you. Thank you, Dana.
Oh, thanks for that feedback on that. All right. Thank you for having the Great Start Compensation Payment Program here to share with you, and others have already thanked you so much, but it's not enough. As we know, thanking you for the work that you do with children and families, greatly appreciated as well. So I'm going to move us into the next slide here. And I did see that there was a question regarding Great Start Compensation Payment Program in the chat, which thank you, Elizabeth, for addressing and make sure that we answer all those questions for you today that we can. So after a lot of work in collaboration with individuals such as you, we're pleased to share details about the 2 new features that are coming to the Provider Hub in July. First, the Great Start Compensation application, and second, a free enrollment and attendance feature. So beginning in July, if you are in the Hub as an authorized agent or a user, in there you'll be able to see tabs start to generate and pop up. And I'm going to show, actually on the screen here below, you see what that might look like on the top banner, where Great Start Compensation will pop up during the application period, and I'll get into that timing, but also the enrollment and attendance feature will pop up, and also help and resources for the Great Start Compensation application enrollment feature will generate as well. So let's just talk about details again. A Great Start Compensation application beginning in July. All licensed and certified centers will make a change in the location of where you submit your application. To date, you've been receiving your application via email. And beginning in July, you will go to the Provider Hub and click on that Great Start Compensation tab to access and complete and submit your application. Again, that clickable link will show up during the application period, and which will start on the 10th of July. So know that if you open it up in July 1st, you may not see that Great Start Compensation tab open till July 10th. But you can expect to see the same questions that's on the application currently that is sent to you via email, and that you access in your email. And it'll be the same that you see in the Provider Hub. Same questions. So the takeaway here is that you'll be asked same questions, just in a new location. And second here, a new free optional feature for capturing enrollment and attendance information will be available to you. To be clear, there is no requirement for you to use this feature. Rather, this is being provided for those who are interested to use a no cost for capturing enrollment and attendance information, as you already are aware, the statute language for the Great Start Compensation Program requires participating programs to collect this information already. And providers are doing this in a variety of ways, like on paper or by using a child care management system, CCMS, such as ProCare or Brightwheel or Elio and others. This new feature in the Provider Hub is meant to provide you with an additional option, if that sounds what's best for your program. And again, we're going to go into the next slide as a reminder that this enrollment and attendance feature is not required now, but understand that this has been a lot of anticipation around the Provider Hub, and we know it's important that you feel fully informed and know what to expect. So if we zoom in on the sequence of timing for the events that might impact you, this may be helpful. So looking at now, June, keep doing what you're doing. You'll receive your regular application via the email, and you should have already opened June 10th, this opened. So worth noting, based on feedback, we heard directly from you that the application period being consistent and a longer window would be helpful. So it is now open on the 10th through the 23rd of every month moving forward. Next July, in that middle here, you'll access, complete, and submit your application in the Provider Hub. Again, the question will remain the same. That's in the application as it sits today. The location will change. So don't worry, we've heard loud and clear that folks want to receive an email reminder that the application has opened, and that application deadline is approaching. So you will continue to receive these emails for a few months to help support this transition from the email application process to the Provider Hub. And a helpful tip is to set a recurring calendar reminder starting in July so that you can be predictive in the future of when to go in there and fill out that application. Last column here for the future, 2025. In the future, a revised version of the application that requires enrollment and attendance data will be launched into the Provider Hub, and you will receive information about details and timing as those are firmed up. We've heard and agreed that it will be critical for you to have information with plenty of time before this change happens in the application. So let's move here to the next slide. We are aware that you've received a variety of directions related to adding staff to your program personnel tab. And to be clear and to confirm for you, we will have you entering first and last names of each staff person that you'll want to attach hours for the Great Start Compensation application in that personnel tab. Again, those hours of staff that are working directly with children need to be attached somewhere. So their names will need to be added first and last into the Provider Hub. This is a one-time activity. So once you have entered that first and last name of a person, staff person in the personnel tab, you'll be able to enter hours for that person in each Great Start application, compensation application moving forward. We recognize that for some larger programs, this can be a heavy lift. So that's exactly why we're telling you now, so you can start the process for a time that's convenient for you. And our last slide here, very similar to what Elizabeth shared in a pathway, and we just want to give you clarity and vision into the pathway of where we've come from the Great Start Compensation outlook. So again, the change in application location is where we're at now, symbol that the Great Start Compensation monthly application will be changing into the hub in July. And the free and optional enrollment and attendance feature will be found there as well. Beginning in July, all applications, again, for the licensed and certified centers will be submitted through the hub. Applications will be open from the 10th through the 23rd of every month moving forward. And looking ahead into 2025, and again, specific timeline to be determined, we'll be presenting, you'll be presented with a new version of that application in 2025. It will require you to submit that electronic enrollment and attendance data at that time. More information and details will be shared as time firms up, and we will make sure to share it with you early and often, ensuring that you have plenty of notice to prepare. So thank you for letting me share. I'm going to try to take a look at the chat feature. It looks like Roz is supporting you with questions. Again, thank you, and I'll be passing this on.
Great, thank you. And hello, everybody. I'm Caroline Olstead. I'm the lead and drinking water specialist with the Minnesota Department of Health. Anna, did you want to introduce yourself?
Sure. And I'm Anna Schleif. I'm a lead and drinking water coordinator at the Minnesota Department of Health.
And today we'll be talking briefly about lead and drinking water in childcare settings. So to start, we wanted to give a little bit of a background on why we're even concerned about lead and testing for it. So lead is a type of metal that is useful for a lot of things, but unfortunately it is toxic when it's consumed. There's no safe level of lead that somebody can ingest, and it's particularly harmful for young people. And that's because lead has negative impacts on things like learning, behavior. It can cause lower IQ levels, hearing impairments, things that we would want to avoid for anybody, but especially for young children because they're still growing so rapidly and their brains are still developing. So hence the focus on child cares for these requirements and for our program.
And then looking at some of the new requirements for childcare centers to test for lead. So in 2023, during the legislative session, a new requirement was passed that would require childcare centers to test for lead in their facilities. So by July 1st of this year, we are looking for childcare centers to have a plan to begin testing all their taps used for consumption. So that's places where you would use the water for drinking water or food preparation at least once every 5 years. And then once you've done that testing and you're reviewing your results, if the results are 5 parts per billion or higher, that would be when you would want to do remediation. The other component is making sure that the results are available to parents within 30 days of getting those results. And then lastly, you would report results and remediation actions to the Minnesota Department of Health. So some things that are new with the statute is that it's now a requirement. We have had guidance for testing for lead since the 1980s. So that guidance is called the Reducing Lead in Drinking Water, a technical guidance, or the model plan. Testing in both schools and childcares has been recommended, like I mentioned, since the 80s. In 2018, the schools were required to begin their testing programs for lead. And so now that requirement is also moving on to our childcare centers. One big question that we get frequently is this related to your licensure? And no, it's not related to your licensure at this point, but pay attention to those childcare modernizations because some of the requirements related to drinking water and other environmental health standards could be revised in those as well. And then I see in the chat that we have a quick question that I can grab. Do we share results with parents if lead is less than 5 parts per billion or only if it's higher? So you want to make all the results available to parents. So even if that's as simple as letting them know that you've tested and those results are available for them. But if they're 5 parts per billion or higher, you want to make sure that you're targeting some education to them about what you're going to do to reduce lead in drinking water. And I think we're ready for the next slide.
So the Minnesota Department of Health has a program that can help child cares meet these requirements. And that's through a federal grant that we have called the Water Infrastructure Improvements for the Nation grant, otherwise known and easier to say, the WIN grant. And that allows us to offer a program that provides free lead in drinking water test kits to licensed child care providers in the state. And participants in the program can either collect their own water samples, or we also work with a contractor who can send someone out to your facility to collect the water samples if that's something that you find you could use a little extra help with. And that's included free of cost in the program as well. And then we also provide the lab analysis of the water samples, which is done by our public health lab in St. Paul. Once we get the results back from the lab, we also provide technical assistance and review of those results. So we'll look through all of them with you, see if any of the water samples did have, some lead that was detected. And if it is over 5 parts per billion, we can also talk about some of the different remediation options or essentially actions that can be taken to lower that level of lead. And then we also kind of throughout the whole process are providing training and tips on best water management practices within the building. Facilities don't have to use our Department of Health program to do your lead and drinking water testing. You could contact one of the other laboratories around the state and order a test kit from them. However, there is a cost for those, whereas through this program, we're able to provide them for free. And then I also wanted to note that for family or like home childcare providers, although they don't have that same statute requirement to test their drinking water for lead as childcare centers do, we still recommend that they do testing considering the age group that they work with. And so home and family childcare providers can still use our WIN program to do their testing. Go to the next slide, please.
And then we also have 2 other grant programs that are available to childcare providers. So the first one is a remediation grant program. This program was authorized in 2023. And this program is to provide grants for schools and childcares that have demonstrated that they have elevated levels of lead in their drinking water. So if you've done that testing and you're finding that you have persistently high levels of lead, this grant can help you fund some of those remediation actions, especially if you've already tried some of the lower cost options. So next year and the next 3 years, we have $239,000 that we'll be able to award to this grant program. Last year, we were able to award $146,000 to 13 applicants. And we estimate awarding between $8,000 and $15,000 per facility, just depending on the different types of remediation that each facility may need. So we've funded things like hydration stations. We've funded fixture replacement or plumbing repairs. So there's lots of options in that grant program. The other grant that we've offered in the past and hope to continue offering is the hydration station grant. So this is a grant that authorizes funding for applicants to put in a hydration station. This grant program is actually for more than just schools and childcares. It's for also targeting community groups that serve children. And it's kind of got a dual purpose. Our oral health program at MDH helps support this grant. So we're also encouraging drinking water versus sugary beverages and prioritizing locations that have a lead risk. Last year, we were able to award 6 hydration station grants. Depending on the amount of funds available each year, sometimes we award even more grants than that. All right, next slide. There you go.
And we have our contact information here. I'll first draw your attention to that QR code on the bottom. If you are interested in using the WIN program to test the drinking water at your facility, you can scan that QR code with your phone camera and it will bring you to our website. And you'll see a link to fill out an online form, essentially just with your contact information, what facility you're with, and then we'll reach out to you and set up a time to meet with you. So that's the first step if you're interested in utilizing that program. And then at the top, we have our program email address. So that goes to me and Anna, and our phone number. If any questions come up, later down the line, we're here to help. Definitely let us know. And then if you're not already a part of our email list, we would recommend that you subscribe to that. It's the lead testing and drinking water email list. We don't send out too many emails, so we won't be flooding your inbox. Just when there's really, big updates that are coming up, like this summer, once we have the results reporting process up and running, we'll send out information about that. And when the grant applications for those grants that Anna just told us about, when those application periods open, we'll send out notifications letting people know. So that's a great one for staying informed with everything that's going on. And I saw we received one question within the chat saying, does this include if you have city water for facilities that have city water, as opposed to some facilities might have a private well, which they get their water from. For those facilities that get their water from the city water utility company, you would still want to test everywhere in your building that's used for consumption, for drinking or for food preparation or cooking. The city does test their water for lead. They usually have a system of testing different households throughout their area, kind of periodically. So it's good to know that usually, they have an extremely low level or more often like no levels of lead that can be detected. But we're kind of looking at after the city's water has left their pipes, their water mains, and gone through all the other plumbing coming into your facility, going throughout your building, through all those different sink faucets and drinking fountains. We're interested in seeing what the condition of the water is at that point. Because there could be spots along the way that may still have old lead plumbing, or maybe there's been some lead that's built up in certain areas over time. So that's what we're looking at.
Yep. The other important thing to think about when we look at lead in school buildings is we're also looking at how the water is used within that building, because schools and childcares are sometimes have intermittent water usage where there may be breaks and closures. That's another situation where, because the water may sit in the pipes for a longer period of time, lead from those fixtures or old plumbing can get into the water that way as well.
All right, thank you.
All right. Well, thank you. There was another question that just came in, so I'm going to let you guys take a look in the chat. Came to me privately, so I just sent it to you all, and we will let you answer that maybe in the chat.
Sure, thank you.
All right, well, thank you. So again, my name is Lisa Mills. I am the training specialist with the Child Care Center Licensing Unit. I spoke with you all at the beginning, and I'm here to kind of provide some additional information from our licensing unit and to say thank you to all of our speakers. And again, thank you to all of you being here. If you've listened on for this amount of time, we've had a lot of incredible information being provided today. So we value that you've taken the time to come and listen to us, because we really all do value the work that we're doing. And we think it's super important that you hear this from us. So thank you. But again, before we close, and we probably will close up a little early. So again, if you have any additional questions, we are still here. So you can certainly send those into the chat. Please send them to the panelists, because I'm speaking now and I've been kind of trying to keep track of the ones coming to me privately and sharing those with the panelists. But if you have additional questions, send those to the panelists, and they will keep looking to see that they are getting all the questions answered before we close today. But again, more additional, some things to know from our Child Care Center Licensing Unit. We wanted you to be aware that we have some training opportunities available. On May 30th, while that time frame has passed, we offered a training on behavior guidance licensing requirements. And again, while that date has passed, we are working behind the scenes with our vendors and digital content specialists to get a recording of that training. We're working to get it ready to post. And so once it does become available, our goal is to have that behavior guidance training recording posted to our Child Care Center licensing webpage as a resource for license holders. And then coming up live on July 25th from noon to 2 p.m., we will be offering a training on individual child care program plans. You can find more information, including how to register to participate, for that ICCPP training, either through Develop, because it is a Develop approved training, as well as through our Child Care Center licensing webpage. Now, again, it's Develop approved as long as you take it in the 2-hour live version. We will, again, hope to provide a recording of that training. And while you won't be able to have Develop approved credit for that recording, license holders can still use, log it on your in-service training records, both either the behavior guidance training or the ICCPP training will qualify for that. Also to note, for anyone interested that you might know who's looking to start a new childcare center or obtain a childcare center license, we want everyone to know that we do and have for several years now offered a 3-part series on a quarterly basis that walks through the process to obtain a childcare center license. So we just wanted to share that opportunity. We have the next series will be offered in August. And so if you know anyone that's interested in learning about becoming a licensed childcare program, a licensed childcare center, I should say, we have that training series being available, and information on that is on the Childcare Center licensing webpage. Along with that new applicant information series, we recently posted a series of informational e-learning videos that cover a variety of topics relevant to both applicants and current license holders. The topics include defining licensed childcare in Minnesota, the business of licensed childcare centers. We have one on facility requirements, one on staffing requirements, and one on policies and procedures. So they're very short, informational little e-learning anytime trainings that are available on our Childcare Center licensing webpage. And next, we would like to inform everyone that we have recently worked with many of our state partners to revise the Keeping Kids Safe resource. The Keeping Kids Safe resource is a resource that provides great information about ways to ensure we are all prepared to keep children safe. We have the Keeping Kids Safe resource linked in today's handout, and it is also available under the training section of the Childcare Center licensing webpage. And then last, another opportunity for you or anyone in the public to ask questions and or hear from us in licensing, along with any of our other state partners, is through the Early Childhood Connector provider call and newsletter. So again, our licensing division participates in these calls and provides content for the cross-agency newsletter that comes out on a quarterly basis. And we work in as a cross-agent, we're a participant in this cross-agency group, along with other areas from DHS, the Minnesota Department of Health, the Minnesota Department of Education, and the new Department of Children, Youth, and Families, as well as the Minnesota Governor's Children's Cabinet, to create this newsletter, as well as provide this comprehensive provider call. The goal of the newsletter and the provider call is to bring important information to anyone interested in early childhood education and early and childcare. The provider call, there's a new, or we offer that provider call on a quarterly basis. And the next provider call is coming up soon on July 16th at 7 p.m. And the opportunity to submit questions to us or any of the other participating agencies is now. And so you can find more information about the Early Childhood Connector provider call, as well as how to sign up for the quarterly newsletter in today's webinar handout, as well as on the childcare webpage. So just all that information we wanted you to know about, in addition to everything you heard about and other opportunities to participate and or provide feedback on all these other great areas. There's a lot going on, as I mentioned earlier, and your participation and your feedback is important to all of us in the work that we do. So we just wanted you to be aware there's so much going on and opportunities for you to participate. So, and with that, I just want to say again, thank you all for attending. That's what we have today for today's webinar. We will work, as I mentioned earlier, to have this recording transcribed and captioned and then formatted in a way to be able to be posted as a recording. Again, it won't happen instantaneously because there's many little moving pieces that have to happen in order to do that. And so we're working on that behind the scenes. And as soon as it's available, we will get it posted to the webpage. It might take a few days or a week or so. But anyways, I want to say thank you again. All of the work that you do for children and families is so noticed by all of the panelists here and everyone in our licensing division. We thank you for what you do. And our panelists will stay on for a little while since we do have some extra time scheduled for today, and answer any other questions that come in. If there's, we'll keep things on. You can certainly ask questions, and I will close things out when I notice that questions are not coming in any longer. And if any of our panelists have anything additional to say or any questions they want to ask or answer, you can certainly hop on now. It does look like we've gotten most of those questions answered though. So I thank all of them for helping out. And yes, I just received one again. Will this webinar be available to rewatch at any time? As soon as we get it into a format that is available and allowable for us to post, we will have this posted to our Child Care Center licensing webpage. So the recording will become available. It will take some time because we work with an outside vendor to ensure that everything is transcribed and captioned and made accessible so that everyone will be able to access the recording. So once that's done, we will get it posted to our webpage. Otherwise, thank you all to everyone. Panelists, are there any questions that didn't get answered?
I don't think so, Lisa.
Oh, good. Thank you. Thanks for answering. All right. Well, then we will say thank you. Have give you some time back to your busy days. So thank you for all of you being here, and have a great afternoon and evening. Take care.